Good afternoon, everyone. I am not Kent Ziegler. He's the guy that dresses with ties and all that kind of stuff. I don't do that. Anyway, thanks for coming today to the Oregon City Business Alliance Forum Luncheon for September. And today we have a special panel in our medical world from Providence, Willamette Falls Medical Center. And they'll be sharing about the hospital and about some of the programs that they have there. So I really appreciate everyone coming. They're a major part of our community. And have a hospital within your community, I think helps the community. It becomes a complete community. I know when I served years ago in our city politics, I was really proud that Oregon City had a community college, and we had our own fire department at the time, not a volunteer fire department, that was way back. And we had a hospital in our community. We've grown since then. You know, it was Willamette Falls Hospital. That's where I was actually born. And now, with the merger a few years back with Providence, it's really expanded its services and is doing a phenomenal job. So I'm going to introduce Brad Henry. Brad is our CEO at the hospital. I say our because I sit on the hospital foundation board, which is made up of a lot of really great individuals. Matter of fact, if you're on the hospital board, I know we've got some members here. Raise your hand. Tony and Jerry, yeah. And Tiffany's our executive director, so thank you for serving on the board. So Brad's been with us at the hospital. I had the pleasure of sitting on the committee that actually hired him, and he's done a phenomenal job at the hospital. Brad, 2.5 years. Come tell us what's going on.
Thanks, Dan. Well, thanks, Dan. It's not every day you get the welcome from a former mayor, so, you know, big deal for me. And Dan didn't say how that interview went. He said he was on the interview panel. He didn't say how it went or how I did, so I guess I did okay, considering I'm up here. Yeah, today we want to talk to you just about kind of current state of healthcare, how things are going, a couple updates from me, and then I have really the experts in the room to talk about our rheumatology service and our behavioral health service. So, and then we'll end with some Q&A. And the one thing I actually want to call out in all seriousness, Dan said, if you heard him, his language was our hospital, and then he qualified that to say he calls it his hospital because he's on the board. Honestly, I would prefer that everyone in the community called it our hospital. It's not my hospital, it's not Providence's hospital, it is our hospital. If you receive care there or your family does, please call it your hospital. And if you have issues with your hospital, call Tiffany. So, just joking, Tiffany. All right, so jump to the next, oh, there it is. And we have a couple people online, is that right? I want to make sure they can hear me okay. Don't want them to miss out on this riveting performance. Sounds good. Okay. So here are some of the updates I'll give to you today. We'll touch a little bit on COVID because what would any healthcare presentation be without a little talk about COVID? Talk about some finances, some interesting market dynamics that are going on, and you guys might have some questions about that. I don't have a lot of answers about those, but you can ask the questions. Some staffing updates, access issues, and then we'll touch on some of the service enhancements, and obviously then I get to pass it off. So let's talk a little bit about COVID. If you've been watching the news, you've certainly seen an increase in news about COVID, a new variant that is present in our communities. There is an increase in test positivity, so the number of the actual COVID tests, the positive tests are increasing in our communities, especially in Clackamas County. So we are being thoughtful about that, and we all should be thoughtful about that. However, at the same time, as the test positivity goes up, what we are not seeing, which is good, is we're not seeing a lot of hospitalizations. So only a little over 1% of our hospitalizations are actually patients who have COVID. So that's good. It means that this current strain that is being transmitted around the community is, it's less virulent from a illness severity standpoint. So people are getting COVID, it feels a lot like the cold and flu, but it's not hospitalizing patients like early during the pandemic. So that is good. We still recommend all of those normal healthcare things, hand washing, wearing masks if you're in a place that you're worried about transmission. We are, just so you're aware, we are requiring our caregivers at the hospital to wear masks with patients now. That's both for our caregiver safety and for patient safety. We just want to make sure that we're doing what we can to reduce any transmission that might happen at the hospital. On the vaccine front, again, if you have not heard, there's a new monovalent vaccine. It's specifically designed for this strain of COVID, and it's available at most kind of pharmacies, Rite Aids, Walgreens, etc. in the community. It's free, just as the previous vaccines have been. It's free to everyone who has insurance, but also if individuals are on Medicaid or OHP, obviously that's covered as well. So they're recommending it for 6 months and older, and as I said, it's available now. So it is good. It's, as I said, it's a monovalent vaccine, which means it's specifically made for this strain of COVID. And then hopefully this is kind of the end of COVID, but we'll see. So healthcare finance. This was a really challenging year in the prior calendar year, 2022. Every hospital, or the hospitals as a whole across Oregon, lost money every month in 2022. You can see up there combined losses of almost $400 million across the state of Oregon for hospitals. Margins fell. Margins in healthcare are pretty low anyways, 3.2% across the state of Oregon in 2021. Those fell to a negative 2.8% in 2022. And that second bullet, 60% of hospitals across the state of Oregon had a negative operating margin. So they lost money last year, which is a little scary from a healthcare kind of sustainability standpoint. We want to make sure our hospitals are financially viable and sustainable to serve the community. It's a really critical piece of what we do. So that is a little scary, and you can see some of the factors there. Increased labor expenses, pharmaceutical costs year after year are up about 15 to 20% year after year after year. Even though we do as much as we can with generics, those costs continue to rise. And at the same time, we had sicker patients. So we are still dealing with the pandemic surges. If you remember, almost a year ago, we had what we called the triple pandemic, which was flu, RSV, and COVID surges all at the same time. So that really put a strain on all the hospitals across the state. So the reality of healthcare finance has led to some really interesting market dynamics. Several efforts from hospitals and health systems across the state to reduce services as a way to try to create a more stable bottom line. And you've seen it in the news. There's been some interesting decisions that have been made. So Legacy Mount Hood tried to close their labor and delivery unit, had plans to close, and if you read in the newspaper, the Oregon Health Authority came in and said, well, you're not able to do that. So Legacy had to go back to the drawing board, figure out how to run a cost-effective labor and delivery unit at Mount Hood, and comply with the dictate from the Oregon Health Authority. Peace Health University District Hospital in Eugene, that proposed closure is happening now. Again, the community and the Oregon Health Authority is pushing back to ask how the community will receive health care if they close that hospital. And then No big surprise, this letter of intent between Legacy and OHSU about a potential merger. Again, Legacy was struggling as a health system and was looking for a partner, and OHSU was available to come in and help support Legacy. That is really, as it says there, more questions than answers. That is really early in the process. This will take probably years to work through all of the state regulations and questions that will come from that potential merger. We are all kind of sitting back waiting to see what's going to happen with that. So really, I mean, when you take the previous slide about healthcare finance and the fact that 60% of hospitals lost money, it's no surprise that we are having these conversations now. What is the future of healthcare? And the smaller hospitals or the smaller hospital systems out there are really struggling to figure out, how do you run a sustainable business? Just like everyone asks those questions about your own business, and that's where healthcare is at now. So part of that challenge is the provider and nurse shortage, and you can see some pretty staggering numbers up here. In 10 years, there's expected almost 150,000 physicians short of the demand for healthcare, right? So both primary care and specialty care. There are multiple factors for why this physician shortage. Some of it's limitations for medical school availability. Some of it is fewer people are interested in becoming doctors because of the medical debt that they come out of school with. So numerous factors that as a country we have to really address what the incentive is to encourage individuals to become doctors and not have $300,000, $400,000 in medical debt, in school debt essentially, when they graduate. The second one is a bigger number there, 275,000 nurses, that shortage in the next 10 years. Again, concerning getting nurses into healthcare. It's especially during the pandemic, we saw a lot of nurses leave the field because it was very challenging, and healthcare is a very challenging yet rewarding occupation. And when we're talking to individuals who want to go to nursing school, we really obviously try to talk about the reward that you get in being in healthcare and working with patients and families, and that service element of what it means to be in healthcare. But that definitely would be a challenge. Some of the benefits of working in Oregon, I don't know if you're aware, but the nursing compensation rates in Oregon are the third highest in the country. So you can really see that healthcare systems have invested heavily in wages and compensation and benefits for nurses to try to keep them in Oregon. We have good patient ratios, so an average nurse has about 4 patients that they're responsible for at a time. Typically, that ranges based on the unit, obviously. But health systems have really done a lot to shore up our nursing availability. So we're hoping, even as this shortage occurs, that we'll continue to attract nurses into the state of Oregon. So we talked a lot about access issues and challenges in the healthcare market, but what I think we're really proud of at Providence, Willamette Falls, is the fact that we have invested millions and millions of dollars into growth on our campus just up the hill. So you can see there, that's the Carol Danielson Suzuki Cancer Center. That's our new medical office building that's attached to the hospital. The second floor of that is medical oncology, so a beautiful cancer service that's on campus that we've been talking about for several years. We're very excited that it's up and live and patients are being seen there now. And we have some amazing stories from our patients who are able to stay in the community for service. So rather than traveling from Oregon City or Canby all the way to Providence, Portland, they're able to stay here in Oregon City, which is really what we are called to do. We're called to serve our communities and our patients and their families incredibly well. So we're happy to keep as many people in Oregon City as we can. So this is a tremendous benefit. Other specialties we've added, we talked about cancer, our behavioral health. So Amanda will talk about behavioral health programming, pediatric surgical specialties and other surgical specialties, breast surgery, orthopedics, and spine, other things that we're doing on our campus to really encourage patients and physicians to practice at Willamette Falls. What happens when Tiffany lets me create my own slides is I forget a bullet, which was rheumatology. So Kim will talk about rheumatology next, but really, again, a service that we are committed to growing in Oregon City for the members of Clackamas County. So with that, I will, oh wait, you're going to say it? Okay.
Well, I haven't done this very often and lately, so I forgot a couple things. One is on your table are these blue and white cards, and one is feedback. So give us ideas of future forums you'd like to hear about or any feedback about the forum today. And then as Brad alluded to, you may have questions about anything he's talked about so far, or anything other, or just healthcare in general. So any questions, write down and we'll have a Q&A time at the end. And then last but not least, I failed to introduce some of our special elected officials. And I see Mark Meek here today. Mark, Senator Mark Meek, thank you for being here. And our city commissioner, Adam Morrow. Adam, good to see you. Thank you. And I know I don't see Ben West. Oh, he just walked in. Good timing. So Ben West, County Commissioner. All right. So now, are you ready to hand off?
Yeah.
Okay. Do you want to do it? Or do you want me to?
Okay. Me? So as I said, I failed to put this bullet on here, but our rheumatology service. So Kimberly Churchwell will speak about our rheumatology program. She's our manager for rheumatology across Oregon. So she's the expert, so any pertinent questions will go to her. So, Kim.
Thank you. Thank you for having us. So just to speak to rheumatology, a lot of people think of arthritis, and rheumatology actually treats many other conditions, including tendon issues, and anything you can think about. Oops, wrong way, sorry. Here we go. So rheumatology actually treats other conditions like tendon issues, muscle issues, and any rare inherited disorders. Some of the diagnoses that you may hear about that rheumatologists treat are osteoporosis, rheumatic fever, bursitis, gout, and rheumatoid arthritis. Just to talk about the history of our department, the Providence Arthritis Center has been in existence for 34 years up at Providence Portland Medical Center. Dr. Bonafide, our medical director, has been our medical director for probably the past 10 years. He started this department 34 years ago with one exam room and one receptionist and one transcriptionist and one nurse. However, today, our continued growth, we now have 8 rheumatologists, 13 exam rooms, and we have a staff of near 40 people. As we've continued to grow up at Portland Providence Medical Center, we've already realized that there's a lot of need here in Willamette Falls. We've been working for the past probably 2 years to open here at Willamette Falls. In 2022, we noticed that we had probably 30% of our patient population was coming to our facility out Providence, Portland, that could have been served here in our community at Willamette Falls. With that continued growth, we started suggesting to executive leadership, how can we expand to Willamette Falls and open up opportunities here in Willamette Falls? So here is our current location at Providence Portland Medical Center. We're in the Plaza there. We're on the first floor at the Plaza, Suite 155. This has been growing over the last several years to where we got to today. In 2019, we started talking about opening at Willamette Falls. Due to COVID, many things happen in healthcare that caused us to pause on some of our projects. And so we've been working at this, probably this is our 4th time that we've tried to open at Willamette Falls. In 2020, in 2020 we paused due to COVID. And then in 2021, we were also expanding Providence Medical Center because we've used all our space at Providence Portland Medical Center. And we were opening the opportunity here at Providence Willamette Falls. In 2022, all of our construction projects for Providence were held for capital funding reasons, and so we were put on hold yet a 3rd time. But as of tomorrow, we are opening our new Rheumatology Clinic at Willamette Falls. We're very excited about that. So this is where we're going to be. We're going to be at the Plaza 1 MOV building. Again, we are very excited about this because we have easy parking up there. We're on the 1st floor. You come right into this Plaza location. You come right down the hallway to Suite 170, and our patients will be able to be served there. We have a small clinic. We think with our continued growth, we'll probably be looking at additional space because even without even open up advertising, we had probably 1,600 outstanding referrals with 30% of them coming from Clackamas County. You can imagine with all of the commuting and the disabilities that some of our patients have, what that's like to have to manage coming to Providence, Portland when they can stay in their neighborhood. So we're very excited about this. As I spoke before, some of our challenges was access. We had 1,600 referrals. We had probably a 14-month wait for our Providence Portland Medical Center patients. We knew we needed to look at how can we serve our patients better. Through COVID operations, we also noted that many of the rheumatologists closed their clinics to new patient care in and around the Portland metro area, so our referrals continued to grow. And again, looking at our space at Providence Portland Medical Center, where we had used every little bit of space up there, having our providers and our staff sharing office space, having limited exam rooms. With every bit of space used up there, we have 13 exam rooms, but if you have 8 providers, you need more exam room space. So again, these were some of our challenges moving into Willamette Falls. So with Willamette Falls, we've addressed the access. We've been able to transfer some of our providers down to Willamette Falls. We will have, at the beginning, opening tomorrow, 2 days a week. We hope in 2024 we expand out to 4 days a week, if not 5. We have been able to hire 2 new rheumatologists that have joined us, one in July, one will join us here in October. We're just very, very excited about this growth. And again, as I spoke before, even without advertising, we have 400 referrals sitting there that can come to Willamette Falls already. And I think you'd much rather come in your neighborhood than come all the way commuting up to Portland, Providence. So for our group, we do routine referrals. We're a referral-based clinic. So you work with your primary care provider for referrals to rheumatology. If it's an urgent need, your PCP can reach out to our rheumatologist and we can find ways to get you in sooner. Any questions? Okay, thank you. Thank you.
Thank you. Okay. So be thinking of your questions as we move to our next speaker, who is Amanda Olsen. And Amanda serves in the Adolescent Behavioral Health Department here at Providence, Willamette Falls. And I'm sure she's going to talk about how unique that is in our state of Oregon. We're very proud to be the home of that. And I'll let her introduce that. And she works in the Pathway Behavioral Health Division. Okay, thanks.
Thank you. So I'm Amanda. I'm the clinical supervisor of our Pathway program at Willamette Falls Hospital. And we are a program that offers 2 levels of care. So one is the partial hospitalization level of care, one is the intensive outpatient. And basically what that means, it's a lot of day treatment for teens who are struggling with mental health crises. So the bulk of the day is group therapy from 10 to 3 every day. But they also have an individual therapist, a family therapist, and a psychiatrist who does any medication management or review of medications. So it's a multidisciplinary team, which is great. And like I said, we help teens who are in any sort of mental health crisis. So we see a lot of like depression, anxiety, people who are struggling with suicidal thoughts, self-harm, some psychosis at times, kind of depending on where the kiddo is. And the reason for us creating this program was that teens who are in mental health crisis really didn't have a lot of options other than going to an emergency department or going into inpatient facilities. So we saw this kind of gap in care between teens who are in outpatient therapy, which is just once a week therapy, and then teens who are in inpatient, which is where they stay at the hospital. So there was this big gap in care in terms of ways that we could give teens more support throughout the crisis, but also allow them to go home at night and be with their families still and be in their communities. The program really aims to reduce future ER visits and reduce inpatient stays, and we do a pretty good job at that. We had some data pulled recently that showed our program was really effective in deterring future ED visits and future inpatient stays. We also try to make the referral process as easy as possible. So navigating the mental health system, especially for parents, can be a challenge. And when you're dealing with a teen who's in crisis, that's a lot to have to go through, a lot of hoops to be able to get into a program. So really our referral process is you give us a call and we schedule you for an assessment. And we initially only took referrals from emergency departments and inpatient facilities, but we expanded that out, which is great. So we can now take referrals from primary care doctors, from school counselors, from parents directly, which is great. They find out about us and they just reach out directly. We also work really hard to have as small of a wait time to be able to see the kids and do an assessment. So at our busiest, I would say it's been a 3-week wait, which in comparison to a lot of other mental health programs is, those are months and months. But like right now, we can see teens tomorrow. We can get them in for an assessment. So we really work hard to keep that wait list as short as possible and get kids into care as soon as we can. We also have a sister program that's over at St. Vincent. So kind of depending if you're on the west side, the referrals go there. If you're on the east side, the referrals go to us. So overall, it's about a 4 to 6 week program, and we really work to get the teens like coping skills, get them safe, get them stabilized. Often they're not going to school or they're not being safe in their community. So the program really aims to like help them practice that, but then also have those skills in place to kind of look at like, where do we think things are going well? Where do we need to beef up skills? And we're also a family-focused program, so families are involved in the care as well. So yeah, I think that's it. Thank you, guys.
So Amanda is deep in the world of adolescent behavioral health, but let's just call out, if you're not aware, up at the hospital, we have our inpatient unit, which is a child and adolescent psychiatric clinic. So that's a very intensive inpatient unit. It's unique in the state of Oregon, serves children and then adolescents up to the age of 18. That's a very rare service to have, so we do have that up the hill. And then you can imagine when that child needs to be discharged, they're done with their inpatient needs, the Pathways program, this partial hospitalization program, is a great next step for their continued kind of recovery and working with family and psychiatrists, et cetera, to get them to that next phase of their recovery. And then they can transition to an outpatient program. So we have all of that up the hill as really the best way in our minds to serve this growing need for behavioral health kind of treatment, especially for our young children and adolescents in the community. So I just want you to be aware, this is a really tremendous program that we have just up the hill in your community. And the need is growing, unfortunately, and this is our way to serve. So thank you for calling that out.
Thank you, Brad. Appreciate that connection between that service that's very unique here and the hospital. So I've got a few questions. Some may be directed over here, but I'll just fire away and we'll pass the mic around. And if you have any others, we'll collect them. Just wave them. We've got people that'll pick them up, get them up here. So what a great need that we have in Oregon and I would imagine nationwide for doctors and nurses. Can you discuss the potential partnership with Clackamas Community College for expanded certification of nursing assistants, the CNA training?
I can speak to that. We need to do more partnership with Clackamas Community College. Can you guys hear me? Yeah, this is. I talked to Tim recently about that opportunity to create that pathway and partnership for, again, we talked about nurses, right? It's the same for any healthcare professional. A lot of us get into healthcare because we want to serve. We have this innate desire to be in service to other people, and that really is what healthcare is all about every day, that we interact with patients and families to provide that service. So there are individuals coming out of high school or wherever they might be in their own career progression that they are thinking, what does healthcare look as a profession? And our job is to work upstream of that need with individuals and organizations like the community college to figure out how do we create programs and pathways that introduce them to healthcare, create that alignment with what it means to be in healthcare from a personal standpoint, and then work through that progression and get them in to Providence or to get them into Legacy or wherever they might go, whatever is right for them. But more than anything, we want people to be invested in healthcare as a profession.
So kind of along those lines, can you share, or maybe Tiffany, but you could probably share, what our foundation has done to encourage some of the existing employees that may be in a position at the hospital to further their careers?
Yeah, this is, I think, one of the things we should be most proud of. And I say we, I think this is a community piece because it is based on foundation donations. So a couple years ago, the foundation dedicated fundraising specific for scholarship programs for our Providence caregivers. And so what we have are individuals within the hospital, most often they're medical assistants or certified nursing assistants or access services individuals who think, oh, I wonder what it would be like to go into nursing school, but I don't have the funds to be able to do that. It's too expensive, or I don't have child care covered, or whatever it might be. So the foundation raised money specifically for scholarships for our caregivers. So Those scholarships, we have individuals apply for those scholarships twice a year, and we award those out to those individuals twice a year as a way to support their tuition needs or housing needs or whatever it might be. Again, and those dollars came from this community. And so it really is our community coming together to support that future progression of healthcare professionals at Willamette Falls. So I'm very proud of it. I know Tiffany is very proud of it, and our foundation board is as well. So
It's really amazing. We get to see the people who have applied, and they come to our events, and they talk about how it's changed their lives. So it's really an amazing program. So with the other hospitals in financial stress, as you alluded to earlier, how in the world does Providence get to expand cancer and it get to expand into arthritis care? How do you guys do that?
well, without peeling back the books too much, I think our advantage specifically in Willamette Falls, and to be honest, it was one of the main reasons that I wanted to be a part of Willamette Falls and Providence in this community. There's a couple. The first was both my kids were born up at Willamette Falls. But the second was that we are on the corner of the market. And what I mean is this kind of southeast market, and you all know Clackamas County and all of the growth in Oregon City, Canby, Molalla, Estacada, even when you think of Wilsonville and Happy Valley, just tremendous growth in Clackamas County. And I wanted to be someplace that wanted to grow to serve the community. And Willamette Falls, in my mind, is that place. So the reason we're able to get tens of millions of dollars to grow a cancer program or to add rheumatology or the Pathways program is because there is a need. We have to grow to serve this community. Otherwise, in my opinion, we shouldn't exist. And growth in the right way at the right time is financially sustainable. At the same time, we also make other investments in programs that are incredibly mission-based, and maybe those programs lose money, and so we have to be thoughtful about that. But again, if it aligns with our mission at Providence, which is to serve the poor and vulnerable, then we want to move forward with that. So it is a balance of growth, just as in any company, right? You have to figure out the best way to grow and what it means for your customers. And I think we've done a good job with that at Willamette Falls.
Excellent. Yeah.
Yes, absolutely. Thank you. Absolutely. The other opportunity for us to grow these services is through philanthropy and growth of the dollars that are donated. There was a significant amount of money that was provided to support the cancer program, the Carol Danielson Suzuki Cancer Center. So again, that's the community coming together to say we want to invest our dollars in our own community and in the hospital. So thanks, Jerry. That's a great call out. That it is not just based on solely on the ability of Providence. It is based on the ability of the entire community to support that growth.
Okay, we're going to keep going.
Yeah.
Must parents of the teens in crisis be covered by insurance?
Yeah, so we take all insurance with the exception of Cigna, but we also take Oregon Health Plan. So, yeah, we take most insurance. So, yeah.
Okay.
Yes, they are. Yeah. All patients are served regardless of their ability to pay.
And that leads to one of these questions I had, which is, what is the percentage, or do you know the percent of care that has been written off as uncollectible each year? Kind of, it related, so I went deep into the barrel.
I don't know the percentage. It's large, and that's what we call our community benefit at Providence, and it's in the hundreds of millions of dollars.
Charity Care of Providence as a whole is $1.6 billion, the largest of any health system in the United States. And in Oregon, it's $389 million in
And what-
2022. 389 million.
389. So
I said hundreds of millions. I mean, I was pretty close.
You were.
Dan.
you're right, within a zero. Yeah. What is the relationship between the general population growth or decline and the impact of the demands on hospital services? The relationship between between general population growth or decline and the impact of the demand for hospital services. So is the demand going up because
Yeah.
of decline or increase in population, or just people getting older, or what's
Both. I mean, I think, so the current trend, so there's two trends. One is the population growth in Clackamas County. At Willamette Falls, we say 5 of the 10 fastest growing cities in the state of Oregon are within our catchment area. Oregon City, Happy Valley, Wilsonville, Canby, Sandy. So, there is tremendous demographic growth in our community that is coming to Willamette Falls. So that growth is leading to an increased demand in services, right? Not just healthcare services, but education, infrastructure, I mean, all sorts of other demands that are occurring in Clackamas County. At the same time, we have a population boom with the baby boomers are getting older, and as they get older and they need more healthcare services, that's driving a demand for healthcare as well. So it is really those two key elements that are driving the need for healthcare services. And I don't necessarily see any slowdown in the growth in the community. Maybe someone else does, but every time you drive around, you see new residences going up, new apartments, new services, et cetera. And I think it feels like that will stay true for many years to come. But I'm not a politician, so I don't know.
No. And neither am I anymore. So the other end of the spectrum of the new housing developments would be those that are homeless. What is Providence doing to help solve the issues around homelessness in Clackamas County and Oregon City?
Well, I think you want to come up here, Tiff? Tiffany's more well-versed in this.
In that same realm, there's another question about the impact on Providence healthcare because of the homeless. So there's maybe an impact question, and then what are we doing?
Yeah, I mean, I'll start with Tiffany can speak more to what we're doing, but ultimately we have to partner with the right individuals and organizations in the community to help deal with the houseless issue. Our mission says really we are called to serve the poor and vulnerable, and that certainly means those that are houseless. And those that often have mental health or drug issues as well. And so we feel that in the hospital. Obviously, we take all comers, whoever shows up at the hospital, we care for. Those are often cared for in our emergency department. Occasionally, and we've seen our emergency department volume grow year after year after year. More individuals who are houseless that we need to work with our care managers to find them housing or to find them a community solution to help them along their path. So we certainly have seen the impact, but again, our role is to work with or the other organizations who can kind of come alongside. So that's where I'll let Tiffany talk.
That's a good segue.
So homelessness is not just an us issue, it's an everyone issue, right? Because it doesn't matter where someone calls home, whether that's, hiding in a tree in a tent or in a house, and they go where they go for services, and we all need to be working together. So for us, we're trying to identify where are the gaps that we can be best able to serve, and who are the subject matter experts that are better at delivering certain services than we are, and how we partner, and how we take that patient from the moment they step through our doors through the care that they need with a warm connection to the next level that they need. So the ways that we do that, a couple of them, you've heard us talk about it before, and we had some members on panels from the BOB program, the Better Access Through Bridges, or Better Outcomes Through Bridges. They work across the entire state. There are teams in every service area, every place we have a hospital, we have BOB teams. So for Clackamas County, they serve out of Milwaukie and out of Willamette Falls. They are essentially case managers or partners once a patient has discharged from our hospitals. So we try to align them while they're in the hospital, catch them there, and then make sure that they essentially have a buddy that walks through their experience with them to make sure that they have access to and stay on medications that they need. For anything from high blood pressure to diabetes to whatever it is that they need, they have it. If we need to be able to reach them, we try to make sure that they have a communication device. Whoever provides that, whether it's our teams or someone else, that they have a way to connect to people. That perpetuates all the way through. We also have a program called Project Nurture. Project Nurture catches pregnant women who have a substance use disorder and does that same thing all the way through their pregnancy and all the way through a year after birth, to try and make sure that we can keep those babies from needing extended NICU stays, that we can keep those moms on track for their treatment, to keep healthy for them and for their baby. We just got a report out a couple weeks ago, recent stories about a woman, I think we changed her name, so she has a different name, but she came to us, she was 3 months pregnant. She stayed in the program, she graduated from the program, and her son just moved into their own apartment from being homeless and pregnant to now being stable in an apartment and able to hold a job. Those are the stories that matter. And this is not unique to Providence. Every healthcare system is wrestling with how do we be a point of entry, a point of refuge, and then a partner with those that do the work well. So this is definitely an us thing.
That's perfect. Thank you both for that. What preventative health care services do you provide? Any preventative health care services?
Lots of preventative healthcare services. That is a very broad question. We have, so I'll just say that the vision statement for Providence across the state of Oregon is health for a better world. So it's a very broad vision statement, and you can understand certainly at the hospital level, acute care, we tend to be more on the reactive side of healthcare, right? Someone comes into the emergency department and we react to what they're there for, and we do a great job with that. But other parts of our organization across the state are more proactive. So trying to figure out diabetes education is a good example. We have diabetes education programs across Clackamas County that serve individuals who need to make sure they're doing everything they can, from foot checks to medication management, exercise, food and nutrition, all sorts of things to make sure that we're preventing those people from coming into the hospital for needs of diabetes care. So we have that. We have wellness programming through fitness. At the Milwaukie Hospital, we have the Community Teaching Kitchen, so that serves Clackamas County. So helping people in the community who need assistance with how to cook healthy meals, where to purchase affordable, healthy food that you can cook yourself. We have teaching classes and a pantry, and that serves all of Clackamas County. So lots of things that we're doing really to try to get upstream of these healthcare problems. So, I mean, That's good. I can go on and on.
So another question here. You mentioned the negative loss in 2022. How do the hospitals make up for that? How do you make up for that, or do you?
One opportunity, as you saw on the slide, is to try to partner with other organizations that can help you out. That's the Legacy OHSU potential affiliation. I think that will continue, that trend across the country will continue, that small individual hospitals and small systems We'll be looking to larger systems to try to help figure out how you gain economies of scale with some back office functions, et cetera, that helps you reduce your overall expense and have an affordable healthcare system. The other, let's go back to the.
That was really it. Where'd you go? That's a different question. I don't know what I did with it.
Thank you.
Yeah.
I was.
Yeah, thanks whoever wrote the question.
I need more coffee. The other is looking at programs, right? So you evaluate programs that maybe are being underutilized, and that maybe have a lower margin, just like businesses do with products, and you try to make modifications to those. The hard part with doing that is the labor and delivery example at Mount Hood. It serves a really critical need in the community. So in healthcare, it's really hard to cut programs out because that means that patients have less access to healthcare. And they're going to be traveling, and it's not as affordable for those families and individuals if you close those programs. So it makes closing programs incredibly hard. That's, we try to manage our expenses. We try to make sure that we're efficient with healthcare, that we're getting patients out of the hospital back home or to a skilled nursing facility as quickly as we can. Not only is it good to get people out of the hospital, but that also helps the bottom line of every hospital. So lots of things that you try to do to maximize your efficiency and minimize your expense. But it is hard right now in healthcare. The other challenge is where I was going to go with this, and you've seen potentially there are articles out there. You saw the margins of hospitals in the state of Oregon are decreasing. At the same time, if you saw the margins of health insurance companies, it's pretty outstanding. There are healthcare companies, United and Cigna and Aetna, that have made billions and billions of dollars every year, about $6 billion for Cigna, I believe, last year, at the same time that their payments to hospitals are not sustainable. So what our system team at Providence does is they go and have very heated conversations with payers to say, we need a sustainable rate. We're not asking for anything that is over and beyond what we think is reasonable, but we want to be able to sustain healthcare in our communities, and so we want a rate of payment that reflects the need. So those are very challenging conversations.
There's a couple things I'm aware of that internally in the hospital have been kind of exciting in terms of saving operational costs. Some water things are being looked at and some gas recovery thing. Do you want to share a little bit? Because that's another way to locally, you can help manage it like a business, which you are, to cut some of those expenses or save some of that money. Do you want to share some things that
so at Willamette Falls, we've had a strong initiative over the last several years to be more of a green hospital. So really thinking about energy usage and waste in our infrastructure within the hospital. And so a couple years ago, we made a decision to go kind of a sole source with PGE, and we get all of our energy from PGE that is green. So it's all solar or wind-based now, and we hope that we'll go to all solar in the next maybe 3 to 5 years, depending on what PGE does. But that's a way for us to reduce our footprint within the hospital. The other is, quick example, every surgery, they have nitrous that they use in surgery by the anesthesiologists. What we found out is we were running nitrous gas through these pipes. The hospital's been there since 1961, remind you. And there was a lot of leakage of that gas. Well, no one wants to have gas leaks, but we were only capturing about 10% of what we were pumping into that pipe. So about a year and a half ago, we stopped doing that. We discovered that we were wasting that gas and that money associated with that, and we went to bottled nitrous only, where you capture 99% of that gas. So just ways for us, and water savings and other things that we're doing across the hospital. Again, just like, I try to do in my own home with LED lights and other things to minimize our footprint and minimize our expense along the way.
Okay. Couple questions for Amanda. They're fairly quick, I think. But are your services just in Clackamas County, or do you operate throughout Oregon? And do most health plans provide unlimited mental health treatment or unlimited coverage?
So, yeah, we are located at Willamette Falls, and we also have a location at St. Vincent, but really we serve anybody throughout the state of Oregon and even in Washington. We've had families drive as far from Corvallis or Silverton or Hood River for our services because there's just such a need for it. So, yeah, families, do that in spite of the drive because they really want the support and the help.
Okay.
And then, sorry, what was this?
Healthcare coverage, is it full coverage for?
I'm not sure of all the specifics. We have an insurance coordinator who's amazing and really easy to get a hold of. So with families for insurance questions, I always direct them there. But with OHP and things like that, it is covered. But yeah.
A couple of questions related to nursing in the recent strike. The nurses across healthcare system are struggling. Providence RNs went on a brief strike. OHSU RNs are close. How is Providence addressing the workforce issues in general and workplace safety?
Okay, well, let's talk about the strike first, and then I'll ask you to repeat some of those other ones. Yeah, so there was a 5-day strike at Providence Portland, Providence Seaside, and Providence Home and Community Care. That happened middle of the summer. The reality is we work really hard to prevent those from occurring. I can tell you our Willamette Falls team, that our contract was open a year ago, and we worked incredibly hard with our nurse managers and our leaders and legal, human resources, et cetera, to get a deal done for our nurses that was respectful, that paid a market rate, but that also is sustainable for the hospital. I mean, that's the balance, and it is truly a balance. Every negotiation is a balance. We want our nurses to be paid a market rate. There's no question. We want them to be happy working at Providence. We want them to stay working at Providence. So retention is a really key element of that. At the same time, we have to understand what the impact of those rate increases do to the cost of health care. The number one cause of bankruptcy across the United States is medical debt. And Providence and every health system, every hospital contributes to that if we continue to raise our prices, and those prices are then borne by our patients and their families. So that is a very challenging situation right now. But we have our contract will open up in 2024 up at the hospital for our nurses. And we will work very hard with the Oregon Nursing Association to prevent a strike, getting a deal that is, again, respectful, market rate, that we keep our nurses kind of engaged at the hospital. What were the other elements of that?
Well, just a longer. I think you covered it. It would just talk about that they were struggling. RNs went to brief strike.
Workplace safety.
Workplace safety, yeah.
Yeah, workplace safety is a very important one. Again, very sad situation that happened at Legacy, Emmanuel, or Good Sam, excuse me. So at Good Sam, the shooting that occurred where one of their security officers passed away. The reality is we need to do what we can on our campuses to create a safe and secure environment. It's unfortunate that we have to have these conversations now. You would hope that a hospital was always a safe place to receive care. But without some security measures in place, individuals can bring guns and other things into our hospitals, which is something we are currently addressing. We have plans up at Willamette Falls to install some metal detectors in our emergency department entrance. That entrance is open 24/7. And so what we need to do is create that kind of secure entrance. It'll be staffed by security guards 24/7. And we current research at Providence, Portland, and St. Vincent's is that it prevents quite a few things from being brought into the hospital that we don't want there. Knives, crowbars, guns, obviously, things that we just want to prevent from getting inside the hospital. And we will also be doing other things at other entrances to secure those. Now, for the patients in the community, it does mean some more challenges with access immediately to the hospital. There might be some doors that are going to remain locked. But again, we want to do that for the safety of those that are receiving care and the safety of our caregivers as well, which, I mean, honestly, I hate having this conversation. I wish we didn't have to do it, but unfortunately we do.
Okay. What is your relationship, or if you have one, to the behavioral health care facility that's going into the U.S. Bank building on Main Street in Oregon City? Or are you aware of that? So no connection. Okay.
No relationship that I know
All
of,
right.
but we should know about it.
Can you talk?
Robin.
What's? I'm sorry. What? Okay. Can you talk about your urgent care and other clinics and how they are helping the demand on the hospital?
Yeah, the urgent care is a great example of a service that Providence has had running for many, many years as a way to prevent some lower acuity cases from needing to go to the hospital. We really only want people in the hospital who absolutely need to be there. And if there are sore throats and aches and pains and other things that community members can get treated at an urgent care or even at their primary care, or even go a step further at a virtual clinic, those services are tremendous at keeping patients out of the hospital. We really only want those people in the hospital that absolutely need emergency care from physicians and nurses. But if there are those other aches and pains, the urgent cares are a great place to go. And if you get screened in an urgent care and they say, well, this is a little more serious, they will direct the individual to the hospital, which is great. We're happy to have that. But it is one way to prevent some of those lower acuity things from coming in. And it also allows for those that are sick and need care, it allows more immediate access and availability for them.
Okay. Amanda, one more for you. Do you partner with faith-based organizations or other nonprofits for long-term care for teens if necessary?
Not specifically. We do have an outpatient clinic within Providence that works with teens for longer term. So obviously, as much as we can kind of make that flow very easy for kids to step down into our clinic, we do that. But no, I can't think of any specific like faith-based, but you know, Providence does have a faith-based element to it. And, you know, we also work with kids in terms of protective factors, like spirituality can be really important to certain families, and how do we enhance that and support that just in looking at ways to help the kiddos through what they're going through.
Okay, excellent. Okay, Brad, back to you. How is finding placement for elderly taking up beds in the hospital? So, you know, the elderly, they get, you know the story. You could explain it and then.
Yeah, no. So a couple things. You know, just as we talk about the challenge with nursing care and access and the nursing shortage, the same thing happened in our adult foster homes, in our skilled nursing facilities, in those facilities kind of post-acute, what we call them. So we want to discharge that patient to another facility for their continued care. They don't need acute hospital medicine. They need just some additional support outside of the hospital. And those facilities have all seen the same challenge that we've seen with staffing. Nurse staffing, medical assistants, CNAs. And so when they have challenges staffing their beds, that means that we have a difficult time discharging the patient to them. COVID certainly had a significant impact on that. And often those facilities wouldn't take positive COVID patients. So we needed for them to run the course of the COVID disease at the hospital. So they stayed with us for longer than we wanted them to, and then we would discharge. So, but really there are not enough adult foster home beds. There's not enough skilled nursing facility beds in the state of Oregon. And what happens is we keep them at the hospital. And when we keep them at the hospital, everything, you can kind of imagine, everything backs up into the emergency department. So the emergency department is the entrance, and then they get to our medical surgical unit, and then they discharge out. So if everything backs up in our medical surgical unit, then everything backs up in the ED, and it means wait times are 4 to 8 hours, and patients are sitting in the emergency department waiting for a bed. So everything just backs upstream, which is not great care.
No, not. Okay, we have a few more minutes, but this is a vision question.
Great.
Okay. So your vision for healthcare and specifically for Providence, Willamette Falls Medical Center in the 5, 10, or even 50 years ahead.
50,
That's
50?
50, yeah, 50. That's a big,
Well, if
So
one of you can tell me what healthcare looks like in 50 years, here's my job. You can have it.
So anyway, your vision, where do you think it's going?
No, I think in the 5-year horizon, we will continue to see some technology advancements that will allow more kind of virtual interactions between patients and providers. I mean, we're all used to talking to family on FaceTime, and now you can do it with your doctor or your nurse. That will continue, but at the same time, the demand for healthcare is going to be increasing. I mentioned this last year's presentation. It still holds true today. Oregon is the least bedded state in the country, which means we have 1.6 beds per 1,000 people in the state of Oregon. That's the least out of 50 states. Florida has something like 3.3 beds, so twice as many beds per capita that we do. So really what this is saying is, given our population, and as our population grows, as people move here from California and other places, we don't have enough hospital beds. So for the next 5 years, and I hate to say it this way, but as populations ascend and decline, I'll be generous and say it that way, the demand for healthcare will continue to increase. And we have to do what we can at Willamette Falls and at Providence and at Legacy to serve the needs in the community as best we can. That's the 5-year horizon. At 10 years, there will be more and more trends in the technology of healthcare. Hopefully that individuals can receive more and more care at home. So one of the things you can research, and we've certainly researched it, is something called hospital at home. This idea that rather than needing acute care services in the hospital proper, there are ways for you to have devices and various technology, monitoring technology, that you can receive hospital-type services at home. Sounds a little scary, but the technology is advancing in a way that you can be monitored effectively at home. So those types of things will allow people to receive needed medical care, but not in the hospital itself. But for Willamette Falls, as I said, this corner of the market, the southeast corner, I think will continue to grow. And our challenge as a hospital is, how do we grow to meet the needs of the community at that campus? Because if you know that campus, we are now landlocked. We don't really have anywhere else to grow other than up or some little small corners of our campus. So our challenge is going to be in 10 years to 15 years, what services do we need to add? We likely need to add more inpatient beds, more specialties, more surgical specialties, and how are we going to do it on that campus?
Okay, there you go. So, anything else? Anybody have a question they haven't written down? All right. Very good. Thank you, Brad. Thank you very much. Amanda, Kim, thank you. So that is our presentation. Next month, I wrote this down, we have a One Water Summit going to be put on by our great people over at WES, and they've got a panel coming in. And really, you think about it, the world has one water. Like, it's not making more. It's just, rain, rivers, ocean, clouds, rain, rivers. It's one water. It's one system. So they're going to be talking about that. And it's going to be a very, very good presentation. I hope you all come back. So I think that's it. We're out a little early today, which is never a bad thing. I always say a meeting is great, it has a beginning and an end, and they're not very far apart. So thank you for coming. Have a great afternoon.